What's up with India's healthcare sector? Philanthropy Foundation Dasra released a report in December 2023 titled An Unbalanced Scale, exploring the female leadership gap in India's healthcare sector. According to this report, it seems like women may be facing challenges in the healthcare workforce. There's a bit of a paradox in the healthcare space. In India, women are said to make up about 80% of nursing staff and close to 30% of doctors. The 30% part might not be as great. And when it comes to leadership roles in India, when it comes to healthcare, that seems to remain elusive to women, with close to 20% of them held by women. That may be why women in healthcare may be earning less than men in healthcare, by close to 35% in India. As of 2021, it said that close to 20% of hospital board members in India are women. And globally, it said that women occupy 25% of senior positions and about 5% of leadership roles in the healthcare sector. Most women are said to be relegated to the front line in low-paying jobs in India's healthcare ecosystem. And it said that fields that are said to have more female doctors, like gynecology, would have more females in sales representatives. In more male-centric specialties like cardiology and orthopedics, sales roles are said to be more male-dominated. What's going on? There might be stereotypes when it comes to women's commitment and competence. There could be a lack of role models and internalized biases as well. And women might be conditioned to have limitations hardwired into their ambitions. They might be told that their goal ought to be to become a nurse, so they may not aspire to lead or manage. And there might be a view that diversity isn't good for profitability. But maybe there shouldn't be more women in the healthcare sector purely for the sake of a metric that might be feel good like diversity. Nearly half of the world's population is women, so it might be extremely beneficial to have someone who represents that half, curate solutions and innovate. And women might have different life experiences and viewpoints that would bring different skills and ideas to the table. That could lead to a more comprehensive and well-rounded analysis of situations, which might mean better informed decisions. And having women in leadership roles could have a domino effect and create more role models for aspiring female healthcare professionals. Should there be more mentorship programs to augment equality in the healthcare space in India? Could there be flexible work policies if that's a barrier for women in the healthcare workforce? As of 2021, India's healthcare sector has about 9.3 million people. 85% of those people work in the private sector and 15% work in the public sector. It said that the Indian healthcare industry reached a value of close to $375 billion in 2023. Can the healthcare industry in India have a paradigm shift towards gender equality?